Hi, I'm Dr. Albert Pendleton. So you've torn your ACL. Let's talk about some of the anatomy of the knee first and what the ACL does. This is a model of the knee. We have four main ligaments in the knee. The medial collateral ligament, that's one on the inside, prevents your knee from doing this. Lateral collateral ligament, the one on the outside, prevents your knee from doing that. ACL, that's the one in the middle, prevents your knee from shifting forward. The PCL, that's the one in the back, prevents your knee from shifting back. We have two types of cartilage in the knee. The smooth cartilage, like you see on the end of a chicken bone, and then the meniscus cartilage, which are like two extra shock absorbers. When you tear the ACL, that allows the tibia bone to shift more forward, and oftentimes when the injury happens, the tibia bone twists inward and the femur bone twists outward, and you end up getting a bone bruise on the end of the femur bone and the tibia bone. Oftentimes, concomitantly, we often get a tear in the back of the meniscus, which is a very common injury. So we kind of have two main options of what we can do after after the injury. Option number one would be no surgery. We work on range of motion and strength of the knee, see how the knee does in the future, see if we continue to have episodes of instability into the future. Option number two would be surgery. For that, usually we harvest the central portion of the quadricep tendon. Then we make one poke hole here, small incision here, dot here. Use that to drill a tunnel through the tibia bone, tunnel through the femur bone, then use that quadricep tendon to make a new ACL in the knee. That's a day surgery. Come in and go home the same day. I usually keep you on crutches for 2 weeks. However, if there's other tears in the meniscus that I'm concerned about, we may need to keep you on crutches for 6 weeks. There'll be a big brace on your leg. I made a video on YouTube as well about that. It shows you how to use the brace. That stays on for 6 weeks. For the first 2 weeks, it just limits your range of motion from 0 to 90 degrees, but after the 2-week mark, we're allowed to bend the knee fully. The brace usually isn't totally required. It's just as a reminder to you, keep other kids away from you at school so they don't play games with you. At the 3-month mark, we can start doing running. 6 months, we can start doing cutting, shifting, pivoting exercises and practices, but usually not live competition until the 9-month mark. I think there's a big difference between when you're just doing practices and drills and knowing what your body's going to do next versus competing in games when your body just reacts. So those are sort of the basic guidelines of an ACL. Now, not all ACL injuries require surgery. It is often very reasonable to wait and see if the knee heals in. About 30% of patients can heal in after an ACL injury, and the knee can be stable without causing further injuries. Now, that being said, if you already have concomitant injuries or other injuries in the knee that require surgical management, then we may decide that it's best to go ahead and forward with an ACL reconstruction prior to further episodes of instability. The downsides of allowing further episodes of instability is that we can do further damage to the knee. We've done several studies that have looked at that. They looked at patients who had surgery before 3 months and after 3 months. Those patients who had surgery after 3 months had more tears of the smooth cartilage, more tears of the meniscus cartilage as well, and they are of greater severity. Now, once again, that doesn't mean that everybody who has an ACL injury requires surgery, but it does. There is a chance of further injury to the knee if the knee is unstable. If you have any further questions, feel free to give my office a call. Thank you.